Welcome to the Woman Up podcast. My name is Natasha Neejee, and I'm your host. Today we have Dr. Ankur Gupta, a psychiatrist and founder of Neejee. Welcome, Dr. Gupta.
Thank you, Natasha. Thank you for having me on
I
your
want to thank
podcast.
you so much for saying for your time today, and I'm gonna commend you for your time because I'm assuming you have a busy schedule. So thank you so much once again for coming.
You're welcome.
So, for people who do not know you, can you please introduce yourself?
Yeah, look, as you said, I am a psychiatrist and I'm also a founder of a company. So essentially, I was born in India. I did my initial medical training in India. I then moved to the UK, Scotland to be precise. And I was in Scotland for about 14 years, where I completed my training in psychiatry and was clinical director for a mental health service in Scotland until I made the move to Australia. And in Australia as well, I've been sort of a clinical director for a public mental health service for several years. And during that time, I found that there were a lot of complaints that I had to deal with, which came against doctors who sort of reported to me. And yes, there are times when people don't do the right thing, but most of the times I felt it was down to poor communication. And that led me to think about, well, what is it? And if you look at complaints, there can be multitude of factors, but the linchpin generally is consent. So people don't feel that they were adequately informed. Consent is a piece of paper in a medical legal terms, but as such, people feel they did not know, or at least their understanding was not what eventuated following their procedure or intervention and whatnot, or doctor's intervention. So anyhow, I'm giving a long-winded answer, but that sort of sparked my interest in doing something which might actually reduce this miscommunication. And doctors undergo a lot of communication training, but that's just not sufficient, I find. So that's where Neejee comes in. So that's how I founded Neejee, and now I devote my time between psychiatry and Neejee. So Neejee means personal in Hindi, which is my native tongue. So the company is about personalizing the whole concept and the experience of consent from a patient perspective. So it's been actually built from the patient perspective. It's not built from a doctor perspective. So
Okay.
that's in a nutshell my journey, really.
Wow, that's interesting. And how does your background in psychiatry um, has helped you or has been an influence in you creating that company?
So psychiatry is, well, you could argue that every branch and every part of medicine is about communication, but psychiatry is particularly more so. So we don't have diagnostic tests. Generally, we tend to rely on communication. So communication is one of the things which psychiatrists are generally good at. So that's, as I said, so Niji is a communication tool in essence, which helps patients feel more empowered, more connected, more sort of heard, if you like. It's being heard, which tends to be missing sometimes, which leads to complaints. So that's what comes in. But I'll also add that I've done a MBA when I was in the UK. Wasn't a healthcare MBA, I must say. It was a generic MBA, but my thesis was co-production in health. So that was my thesis for my MBA. So that has particularly been helpful because, again, Niji is about co-producing the consent process. So it's not just a doctor says, do this, the patient signs, which is a one-sided process in which the patient is a passive recipient, if you like, to actually make it a more dynamic process where it's actually led by the patient and the doctor is a signatory on the consent form, which is essentially being created by the patient with regards to their own specific needs and concerns and wants, if you like. So that's how it's
Oh,
been sort of helpful.
I'm loving that. Can you describe any innovative technologies or methodology your company employs to improve compliance and consent processes?
Yeah, I mean, look, what we did, so we looked at, we did a lot of literature search around why patients complain, why litigation happens, and again, as I just come back to the word C, which is communication, but at the other side of the debate is that sometimes there are expectations which have not been met properly. So, there is a chance of things going wrong in any procedure. And sometimes you do
Mm.
not even get the desired result. Pain is a specific example. So, back pain, people undergo surgery, some get better, but some don't. And sometimes the pain is even worse. And so that sort of understanding of, well, what is realistic is what we've come about. And so within Neejee, what we have is we give the patient an opportunity, even before they've seen the doctor, to tell them, A, what their concerns are, and B, what their expectations are from the procedure. And the form cannot be completed unless the doctor actually answers that in black and white and in a language which is understood by the patient. So, we don't want he said, she said, I understood this and that wasn't said. That goes out of the window. The form is always available to the patient at all times. So, whatever is written by the doctor. So, one of the things which is problematic in healthcare from my perspective is that it's not a very democratic process. So, if you were, for example, signing up for a financial product, you would be given a full disclosure and you would have full access to whatever the financial advisor is saying. So that's money. This is your own health. Most of the times,
Right.
what the doctor writes stays in the doctor's system. You don't even have it unless you ask for it. Yes, you've got a right to ask
It's
for it,
true.
but how many do? And it's still a process to go through, which puts people away. But why? What is it that needs to be hidden? What is it that a patient cannot have access to? So that's where Niji is. So it's more about a process. So the process is innovative, I think. So the process is the patient knows what they're saying, the patient knows what the doctor has said, and it's there, black and white, between the two parties.
I'm
Um,
loving that.
and
Go
then
ahead.
we're so sort of enhancing it now to look at feedback post procedure, and again in a way that helps patients to tell a doctor what happened and what didn't go so well and what might have gone might have been done better for the next patient.
I'm understanding that it and that you are empowering the patient in that process. How what kind of challenge do you see that you've seen or do you have had in the past, uh whether it was on the doctor side or any professional sides? Do they respond well to their part of doing the side of the process?
Yeah, okay, I think what I would say is that generally doctors A want to do it all and B think they're doing it all. And that is a barrier. It is a barrier because they think they're doing it all. It's not as if they don't want to do it. They just think they're doing it and it's fine. And and they base it on the sort of assumption that because most of the patients are happy, most of them never complained or they've never had a complaint themselves. So whatever they're doing must be right. And why change something which ain't broke? That's the sort of thinking around it. Uh, the issue is it takes a lot for a patient to complain. So if somebody has complained,
That's
then
true.
they've really felt, being treated poorly and whatnot. So a lot of patients might be going unhappy, but not complaining. So, there is that. And the other bit is, it's all okay until somebody complains. And then when they try and find out, then you find that there are things that you could have done better. So that's the barrier. It's the barrier in thinking around, well, we are doing it all already. Whereas when we surveyed patients and when we look at published research on this, most patients sign a consent form just so that they can have a procedure. Most patients do not read what is written on the consent form. And the issue has been taken up by courts. If you look at recent judgments across the world, really, whether it's Australia, UK, Canada, US, anywhere, you will find that the courts have taken cognizance of that. And they are basically saying that your average patient can be forgiven for not having read all the details that you have provided on that piece of paper, or misunderstood, or never read at all, because you're just drowning them in detail. So that's where the problem is. And what we try and do with the consent form is to make it pertinent, as I said, personalized. So only the outcomes which are likely for a particular patient are highlighted. Yes, you can give them an additional information about everything else that might go wrong, but what a patient is most interested in is for them, for their individual self, what are the type of things that they need to worry about, and then make a decision whether they want to go through with the procedure or not. Any procedure can cause infection. Yes, infection, but who's going to, unless you have diabetes or underlying immunocompromised status, that is probably not that big of a problem. So those type of things. So what is pertinent for a pertinent patient is where we need to come at and make it more nuanced, all that process.
Can you tell us, sorry, in your background, how's your background of psychiatry? Where was it more, where have you you noticed that, how were you able to reconcile it? Or how were you able to be like the third party? Because I'm understanding that you create a platform that's in between, but how were you able to put those parties to come together?
Yeah, I mean, look, the platform as such. So what's happened is, as I was saying, there's been a lot of, there are barriers around physicians undertaking something like this, but there's been a lead which has been taken by the health regulatory authority here in Australia. And I think it was probably going to come to other countries as well. So cosmetic procedures are a big thing. So cosmetic procedures are where there is a little lack of oversight, if you like. So anybody can go as a cosmetic physician or a cosmetic clinician. There are multitudes of pathways, some recognized, some not well recognized. And the procedures are becoming more and more and more, and particularly women, if I might add, are at risk in terms of getting procedures done. And then you've got side effects or ill effects happening afterwards, and costs. So there are a multitude of things that the health regulatory authority here is looking at. So that's been actually a catalyst for us in terms of offering it as a solution to cosmetic practitioners, and people who are using it. I must say we've not had a single complaint till date. Touch wood. Obviously we are small, so the numbers might not be large enough to make a conclusion, but so far so good. Also the fact that my experience as a clinical doctor who's still in practice, who's been a clinical director, is helpful in that regard, because at the end of the day, it doesn't really matter whether you're having a paracetamol being prescribed. I mean, it's over the counter, I know that, but anyway, you get the gist. Versus neurosurgery, the law of consent is the same. It is the same principles of consent that have to be applied to each and every encounter. And you'll be surprised that the law is so similar across the world. You name it: China, Saudi Arabia, Anglo-Saxon world, Europe. The law of consent is so similar. They all talk about the same principles, and all ask the clinicians to follow the same principles. So, that's why, I am a third party, but perhaps not even a third party because, I'm in it as a clinician myself.
Mm-hmm. Tell us, because now we're talking about cosmetology, cosmetics procedures. We know that it's a phenomenon that a lot of women travel all over the world, goes to other countries mainly for cosmetics procedures. Um, and sometimes they go to a country that they don't know actually. How does your how do you respond to that? And is it something that it's gonna be is it an issue that you'll be able to address in the future or currently addressing?
So, look, I'm glad you've asked that question because I wrote an article on this in a magazine about it. So, you know, um, the problem is jurisdiction. So, let's say somebody from Australia travels to X country for a procedure and they have a poor outcome. The doctor that or the clinician who's doing the procedure is registered in that X country. Uh, the person who's traveled is an Australian. So where do they complain? Do they complain in Australia? And what can the Australian authorities do even? Or do they complain in that country and the country that they may not even be speaking the language and incur all the bills? So they take the easier way out, which is, you can grunt about it. Perhaps you can put a few social media posts about it and then you leave it. So it's a landmine in terms of medical legal law because uh, the logical step is to actually complain in the country where the clinicians registered because only they have the authority to do anything. But it is very hard for an international patient to do it, just logistically, financially, everything else. It's just not possible. So what I would say is if one of the things that Neejee does is really gives patients an option to engage in that process. And I'm not saying things will not go wrong, but at least you'll be better informed. But again, the customers are not patients. The customers are the healthcare providers. So they have to take up the cause of the patient. But I have no qualms in saying that we have created this from the perspective of the patient. It is not created from a clinician perspective simply because it's the patient who needs to feel empowered. It's the patient who's making a complaint, and their needs are paramount, have to be taken on board. Um, so, essentially, what I'm saying is that medical tourism, there is no easy answer for this, just because of the way legal jurisdictions are.
Mm-hmm. Right. And on and on that same line, could you share some success stories or cases studies where you had you've seen success stories, significant impact in the healthcare organizations? I understand that we can't go like in details because obviously it's confidential, but generally speaking, what kind of success story that we can are you able to share?
So that's difficult. That's difficult not just because of confidentiality, but also the fact that I don't have access to patient data. So the way we've set Neejee up is nobody else other than the treating clinician and their team has access to any data, anything. Not even in the back end can we look at it. Simply because of patient confidentiality in the
For
field that
sure.
we sort of operate in. All I can say is, as I said before, we've not had a single complaint amongst our customers. So that's one of the things. I can also say that I, as a treating psychiatrist, use my own system, obviously. And one of the things we tend to do is with, for example, somebody with a probable diagnosis of ADHD comes in, and we are able to sort of present them with why is it that they're coming to see me as a psychiatrist, what is it that they want, and what is it that their concerns are, and then that opens up uh, a dialogue which is more robust, more enriched, and more tailored to a particular patient's needs and wants. And I do feel personally, and I might be biased, that I feel on a firmer wicket when I'm doing that, because I know that the patient who's come to see me, their concerns I'm well aware of. Because if I don't answer to their concerns, then I've missed something. And it's okay to ask them at the sort of at the consult, which is great. You should do that. But sometimes the power differential is such, or the patient might be anxious and whatnot, that it's not possible for them to be able to open up in that small window that they have with the clinician. So our form, people do and provide all that information at home. They've got all the time to think about things and do it. So you can be reasonably assured, but what you're getting is a concerted opinion or a concerted sort of, dialogue from the patient.
Mm-hmm. I'm loving that. I think you're bringing a very human side of the human side really comes through in your approach. Can you tell us how do you collaborate with professionals or institutions to tailor your services to their specific needs or challenges?
So we are in the so this so Neejee can be used internationally. There is no bar on it being used. We are a small startup. It's bootstrapped, so our budgets are very, very tight. So I have been to several conferences here on medical legal and cosmetic practices, where I have presented. I've been invited to speak at certain sort of conferences as well. For example, one of the places where I was invited to speak was at a conference for people who have visual difficulties. So one of the things we do is uh, we allow audio recording within our system of the consenting process or the dialogue that a person has with the clinician. So, one of the things that research tells us is that people with print difficulties, people with early cognitive decline, people with anxiety, uh, the best way to consent them, just to ensure that they've understood everything, is so that they have an opportunity to listen to what's being said by the doctor later. So they do it slowly, they can sort of hear. So we allow audio recording. And that audio recording can be shared with the patient, and the patient can then sort of hear it and provide their consent for a procedure. So those type of things one tries to do, but as such, I think it is marketing is one thing that we need to sort of find some more money to tell our story about. It's just that.
I can relate. What do you see as the future trends or even challenges that your company is preparing to address?
So, as I mentioned slightly before a few minutes ago, was that one of the things which is also coming from health regulatory authorities across the world is feedback. So, real-time feedback, both from peers and from patients. So, we are in the process of developing a module which allows patients and peers to feedback on a clinician. And that's important for our core product as well, because sometimes all patients want to do is to vent their feelings and actually tell somebody, well, this is what they were unhappy about. It's okay, but they were not happy about particular thing. Uh, and that not only enhances their own experience eventually, but can also sort of lead to reduction in the risk of complaints and all. So we are developing that. That should be sort of released very soon. And then we keep attuned to all the regulatory changes that are, that come or are coming, and sort of, are able to modify the product accordingly. And I would say again that the informed consent law is not going anywhere. It's the same across the world. It's just, certain requirements, certain tweakings that have to be done, and that we are able to do within our system quite effectively and quickly.
That's amazing. Dr. Gupta, it was amazing to have you. I want to ask you this last question as we are wrapping up. What is your legacy and what do you want people to remember you for?
Well, I think if, um, you know, I'm not thinking about legacy just now, or hopefully I've got a good few years to create a legacy. But beyond everything else, I just think that if we are able to reduce the burden of complaints and litigation in society, then that would be a job well done. Um, Complaints cost the society. The payouts are getting larger and larger. We're talking billions of dollars in, for example, in the UK, NHS paid out what $2.1 billion last year or something in terms of compensation claims. But ultimately, that is the society's money. The healthcare system is poorer by that money, which could have been spent on some other services. So, and there's also research which states that, if patients feel happier about their process, then they tend to recover quicker. Uh, so that reduces the spend. So anyhow, what I'm basically trying to say is, there are several indirect costs of malpractice litigation, which impact all of us, the whole society in general. And if we can make a dent on that, then I think everybody would be happier. And that would be a great way to sort of look back at my career, I think, eventually.
Thank you so much. You've been such an inspiration for me and my audience. I want to thank you, Dr. Gupta, for your time once again. And I'm hoping I'll be able to have you back on the show eventually.
Thank you. Thank you, Natasha. I think you've asked some very insightful questions, and I thank you for that.
Thank you. Thank you so for to my audience. If you've been listening all the way down, is that you've been supporting the channel. Until then, woman up.
You are listening to the Woman Up podcast. If you enjoyed this episode and you'd like to support the podcast, please hit the follow button, share it on social media so we can send you a shout out. To get information on public speaking coaching with Natasha DG, reach out by email at contact@natashadg.com or by phone 514-558-5777. Thanks again, and I'll see you on next one. Until then, woman up.
Tracy, it's been amazing having you on the podcast, and I'm hoping we could get you back eventually on the show. Thank you so much for your time. I want to thank my audience for tuning in. And until the next time, woman up.
Thank you, Natasha.